Get it, insert.
Well, good afternoon, everybody. So glad you're with us. My name is David Jones. I'm Vice President of Advancement and Community Relations, and we are just so happy to have you with us today. This conversation about having an event like today has gone on for several years, and more intensely over the last 3 months, and today was the day it's happening. So I think you're going to be so pleased when you walk out of here in 90 minutes, and the 90 minutes is going to fly by. We have just a special presentation that I don't want to take any more time away from our special guests here today. But I want to say 66 years ago, these four ladies were, like many of you, and finished nursing school. There was a book written about the last of the best. It's available in the bookstore in the library. And I'd like to read just a paragraph from this book. This reflects the Memorial Hospital class of 1954 nursing school. So please don't take any offense in anything, but I think it helps set the tone for today. Somewhere between Florence Nightingale and the mid-20th century, Herndon became accepted norm. Young women entered nursing schools, were placed in buildings called nursing residence with strict rules to govern behavior and facilitate learning. Teams of nursing instructors were hired. The basic philosophy was that boot camp strictness like methods applied to turn silly young ladies into proper, respected, dedicated, sick care providers who would also exhibit persons of high moral character in their personal and private lives. So at this time, I'm very, very pleased to welcome Gail Hebner, whose mother was part of this class, who would like to introduce our special guest today. So Gail, thank you for being here.
I, too, am only going to take a few minutes because I don't want to take any time away from these ladies. These ladies have been my inspiration my whole life from the time I understood what people did. When I was 2 years old, I thought all mommies wore white stockings because mine did. And I didn't understand when one of my friends' moms put on brown stockings to go to church because I thought everyone wore white stockings. My mother was a member of this class, and these were some of her dearest friends, and they've inspired me my whole life. I'm a nurse as well. I went to Penn State and graduated in 1976, and I spent 33 years in uniform in the Army Nurse Corps and in the Public Health Service. I got to serve on the Surgeon General's staff. I worked for the Food and Drug Administration. I was assigned to the Clinical Center at the NIH. And I worked at Walter Reed, among other wonderful assignments. And I wouldn't have gotten to have that career or that life if not for these ladies. These ladies graduated in 1954, the year that I was born. And the stories that I have heard from them and from my mother for years, when you hear their stories, you will understand that it is their shoulders that you are standing on. They have broken so many barriers for nurses over the years. And to this day, it gives me goosebumps just to stand up here and talk about them because they truly are some of the most influential women in my life. And so please listen to every word they have to say and ask them questions and get involved in the discussion because they have so much to teach you. This is Jeannie Phillips. This is Jenny Northcraft. This is, Janie Kuhn. And this is Pat Pyles. And they are going to talk about their careers and what they did with their education and how their lives played out, and they're going to do that each individually. So with no further ado, I shall give the mic to Jenny.
I'm Virginia Northcraft, and I started out in surgery, then pediatrics, then University of Maryland medical surgical floor, then ER in Memorial, supervisor of newborn nursery in Kaiser for a year, and then I went to public health for 30 years. And after public health in Mineral County for 30 years, I worked 5 years at the Potomac Center as director of nursing care for the staff and the clients for 5 years, and then I gave up. So anyhow, I'm going to start with us when we took the test to get into nurses training. And if I trigger anything of their memory, they're going to jump in and tell you some crazy stories probably, because we really were a crazy class. And we were once said that we were the best class that had ever gone through Memorial Hospital School of Nursing. I'm sure there's been improvement since us. Okay. Anybody else want to talk right now? You want me to go ahead and start?
Are we supposed to tell them?
Well,
our
okay, tell
thing?
who you are.
Okay.
We
Okay.
never did this before.
We know we're a little rusty. I'm Jean Macfarlane Phillips. I started out after graduation. I went back to my hometown in Everett, Pennsylvania, and I worked for a surgeon there. And then I got married and moved back to Frostburg, where my husband was from. After he graduated from college, we moved to D.C., and I worked at Providence Hospital. And then I came back when he got transferred back to Allegheny County. I worked at Memorial, and I was just worked all floors for a while. And then before I retired, I was head night nurse at OB/GYN floor. Let's see, and I guess I nursed for 31 years, and then I opened a uniform shop out in the Vale, where all these little uniforms are from. We've had that almost 40 years now, but my daughter took over for me the last 14 years or so. So here I am.
Okay, Jane.
I'm Jane Kuhn, and like them, I graduated in '54, and I stayed here long enough to go to Baltimore and take the state board. But in the meantime, I was reading Life magazine, and I had a big article of MD Anderson Hospital in Houston, Texas, and I thought, boy, that sounds interesting. It was all cancer and cancer research. And I thought, I'm ready to learn some more. So I got 3 other girls to go with me. We didn't have much money, and we had 1 car, and we got to Texas. And that was a real trip in itself. But anyway, I had written and made an application, and I was accepted. The other 3 didn't even have that. And whenever we got there, I had said I wanted to work surgery. And at first they were going to put me on the floor, but all of a sudden they're interviewing me for surgery, which I was thrilled. Totally different anything I had ever seen. The amazing thing to me was the difference in the instruments, the difference amount of instruments that they used. When you set up a Mayo, we would start out with like 3 dozen hemostats. They would be used one time, discarded in glove wrappers, handed off to the instrument girl, and they would scrub them, autoclave them, and keep them coming, and all the instruments that way. 1 slice with a knife, that knife was replaced with another one, and we'd have a whole stack of knives. And it was just so totally different that, and I worked there for 15 years, and then it got to where I had 3 boys and raised them myself. I felt I needed to be around home. So I came here, went to work at Sacred Heart, and worked there, and then I wanted to work where I could get more benefits, so I went to the Kelly, furloughed in 2 years, but it was when, not Sykesville. I can't think of the,
Went to the Finance Center after.
yes, thank you. I went to the Finance Center and retired from there after 16 years. But everything was different each time I changed. And it was a learning experience, and I don't regret it one bit.
My name is Pat, excuse me. My name is Pat Pyle. I'm the least experienced of them. I graduated and went back to my hometown, Somerset, Pennsylvania, and I did private duty for 2 months when I got married and went to Alaska for a year with my husband. He was in the service. When we came back, we went to Hagerstown and I did a period of about 6 years on a surgical floor. And then we had 4 children, and then I went back and did about 4 years on full-term nursery. And then my husband decided to start his own business, and I became a secretary. And my nursing went to retirement. So I did not really put it to use in the hospitals and all, but I feel that it was a great benefit as far as raising our children, taking care of family members that were ill. We had our dining room 3 different times. We had a hospital bed in it because my mother-in-law was there, my mother was there, and my husband was there. So it did do me good, although I didn't do all the fun things they did.
I will say, looking out in the audience, it's good to see all these men. I mean, the one thing, yeah, that is the biggest change, but the big change I saw in the years that I've been nursing, the pay wasn't the best, but our pay raised when the men came in. That made a difference. And thank you guys, you did help me.
Okay. This is how we started. The examination of entrance was given at Fort Hill High School on a Saturday morning. And each successful applicant had an interview with the director of nursing. My question she asked me was, am I wrong?
Well, no. I just thought I'll free up your hands.
Oh, okay. Thank you. Anyhow, my question was, are you promiscuous? Well, 17 back in 51, I didn't even know what that meant. Now, that was my question about whether I was going to get to go nursing. Okay. The list of items we were to bring were 6 cotton bras, 1 cotton garter belt, 6 cotton panties, 6 full cotton slips, black stockings, black Oxford-type shoes, a plastic or a rubberized apron that we were to wear in the lab. And we had to have a name tape so it could be sewed in our uniforms, and we had to have hair nets. The first year's tuition was $202, and it had to be paid on our first day. And it covered all our books, our uniforms, our lodging in the nurse's residence, and our meals. We received written notification when we were to report to be measured for our uniform. The uniforms consisted of 1 navy blue sweater, cardigan style, 6 blue and white striped dresses, 6 white aprons that had 4 removable buttons on the back of the waist, and that's where we would slip our bandage scissors in, so if the doctor asked for them, you could whip them out really quick.
Those aprons were starched stiff.
Oh, I'll get to that. Okay. Let's see. The scissors were engraved with our name, and a good nurse always has her scissors. And we were even told that the point on the scissors, if somebody needed a tracheotomy and you were at a wreck or somewhere, you could do a tracheotomy with that point. So we always had our scissors. After the 6-month probation period, 6 white bibs were added to the aprons with safety pins. And then we had a capping ceremony, which was held in the auditorium of Fort Hill High School. And we wore the complete apron with the bib attached. We received our plain white linen caps. Well, you'll see the poor girl over there. She doesn't even have a wig. And we received our pins, and we had our pin had our name, Miss Macfarlane. You never went by a first name. You were always called Miss whoever. Okay, when we received that, we were proud to wear our caps on duty or any time we were in uniform. Our name, as I told you, on the pin, and it's up there, it's gotten yellow with age, and the uniform's kind of yellow with age, but you got to figure it's 68 years old. And we were given a little Florence Nightingale lamp, which is over there, has a little white candle, and we recited the Nightingale Pledge. The apron hem was 11 inches off of the floor. And it didn't matter how tall you were, when we all lined up, and you'll see them in the pictures, everybody's apron hems, uniform hems, are the same level in the picture. Okay, let's see. The first 2 years, we wore the black hose and shoes. And then at the end of 2 years, some of the girls went to Constitution Park and burned the black hose and shoes. I was on duty that night, didn't get to do it. And then we wore the white hose and shoes. And let's see, and they were leather, and we polished them every night with white liquid shoe polish, because you would never go on duty with dirty shoes. And we would not be caught with a dirty uniform. So if we were on duty and we got a spot of blood or some other stain, and a lot of the solutions and all were in stock jugs, so you know, you got messed up. We would cover that with a piece of white adhesive tape until we could get back over to the nurse's home and change our uniform. The hospital laundry did our uniforms. The collars and cuffs were starched so stiff they would cut into our necks and upper arms, and I mean stiff. So we would rub them with ivory soap, and that would kind of make them a little softer against our arms or our neck. The director of nurses, Mrs. Gladys Brooks, RN, stated we were to look like crisp lettuce leaves. Our hair must be above the collar, no nail polish. A patient would not want somebody taking care of them that had blood looking, or nail polish that looked like blood dripping out of their fingernails. So we didn't wear any nail polish. We were not able to wear necklaces, bracelets, or rings while you were on duty in uniform. And if your ears were pierced, you had to wear little gold studs. And of course, a lot of the girls didn't have pierced ears, and I still don't. But a lot of them would pierce each other's ears with a darning needle, black thread, and an ice cube. And when we entered training, a senior student was designated to be our big sister to guide us through the first life of student nurse training. The nurses' residence had 3 floors, and the first year students were on the 3rd floor, and no elevators, 3 flights of steps. No cell phones. We never even heard of a cell phone. There was 1 phone on the floor, and it was in like a closet on the wall, and that was for 40 girls. And we couldn't talk long, because that phone also, if we were on call in surgery or obstetrics, then they would call over to that phone to tell us to get over to the hospital. You know, we were going to be doing a case. And I'm sure that would really amaze all of you, because y'all got phones. But anyhow, let's see. Huh?
They had the call room downstairs, and you'd sleep in the call room downstairs, and you would sleep in a call room downstairs, and if you were on OB or surgery, you could sleep there, and there were 2 twin beds in there, and that way it wouldn't disturb everybody.
Okay, the bathroom had 6 wash basins and 6 toilets and a few showers. The rooms were tiny, and they were furnished with a metal bunk bed, 1 metal desk and chair, 1 metal dresser that had 2 small drawers and 2 large drawers. So each student got a large drawer and a small drawer, and we were to keep our aprons, which we had 6. When they came back from the laundry, they had to be laid out in the drawer. And our few clothes, we didn't have a lot of clothes then. Not like now.
We never wore them.
And let's see. Each room had a very small closet for the 2 girls to hang their clothes. It could be locked. Some kept wooden ironing board and an iron in the closet along with snack foods, but we kept it locked so the house mother didn't know what was in there. Beside the 2-person rooms, there was also 2 4-person rooms on the floor. The class of 54 started with 40 students. 1 girl quit after only 3 days. She said she didn't want to be there in the first place. And one did not pass the probationary 6-month period. Another one got married and got pregnant and was dismissed because of safety concerns for her. She had not had her psychiatric training at Sykesville yet, and that was another story. And she returned several years later and finished at Alleghany College, and that was Gail's mother. There's Gail, Gail's mother. And she was a great nurse. Okay, let's see where we are now. And actually, she came back and finished at Alleghany College when they first started the program, and Memorial didn't have the program anymore. Our class was the first one allowed to get married in our senior year. And if a senior was to be married, she had to be measured for a diaphragm. Several of the girls were dating fellows who were serving in the military during the Korean War. The classrooms were in the basement of the nurses' residence, and the asbestos-covered heating pipes was over our head below the ceilings. Mrs. Chase was our name of our practice mannequin. She was covered with oilcloth and weighed a ton. She doesn't look like anything that you all train with. And she endured many catheterizations, injections, and enemas. And she never, ever complained. The first 6 months, we were transported by bus to Frostburg State Teachers College, which is now Frostburg State University, for our science and physical education classes. Anatomy and physiology, chemistry, and biology were taught by college professors. We dissected formaldehyde cats. One had 4 kittens in it, and 3 were taken to the biology teacher at Fort Hill because he wanted them, and one was kept by the student who put it on her mother's fireplace mantel in a jar. And when she got married, her groom would not let her take it to the apartment. It was a little black one. It was cute. Physical education consisted of folk dancing and tennis. And I didn't really like tennis at all at that time. Chemistry was taught by an eccentric elderly man who told us, if you want it, you got to dig for it. And that's what we had to do because most of us struggled with chemistry. But we were very fortunate that the hospital nutritionist was very knowledgeable in chemistry, and she would come to the nurses' home in the evening on her own time and tutor us in our class assignment. And we would have never passed had she not been so generous. And she ended up being a red-headed movie star in Italy. Our nutrition classes were taught by the nutritionists from the hospital, and we went to Fort Hill High School in the economic classroom, home economics classroom. We had a 6-week rotation in the hospital diet kitchen. We prepared approximately 60 meals 3 times a day and evening snacks for patients who were on spatial dietary restrictions. Salt-free butter was not available then. So we would put the butter in a glass refrigerator dish of cold water, put it in the refrigerator overnight, and that would draw the salt out of the butter. So hence we had salt-free butter. The classroom instructions were doctors and nurses from the hospital and Allegheny County Health Department. When a doctor came into the classroom or the charting area, we immediately arose from our seat and stood at attention until he sat down, or she, but it mostly were he's when we were there. And that was to show respect. Do you all stand up when the doctor comes in? We did. We had a 3-month rotation in pediatrics, surgery, obstetrics, labor and delivery, and newborn nursery was all under obstetrics. The dispensary, which is now called the ER, medical and surgical floors, public health, and psychiatry. The psychiatry 3 months were spent at the Springfield State Hospital in Sykesville, Maryland. We were housed in the Jones Building. Our school was part of a group of students from Johns Hopkins Hospital, University of Maryland, Laird, North Carolina, and a nursing school that I can't remember in West Virginia. So if any time there was a patient that needed an enema or a catheterization, you never saw those university girls raising their hands that they were going to help. It was always the girls from Memorial in North Carolina. We were the ones that apparently knew how to do it and didn't mind doing it. On all our rotations, we did not just stand around and observe. We were hands-on in surgery, and the hospital saved a lot of money with us. We were scrub nurses, setting up the Mayo stand with the sterile instruments for surgery, handing the instruments to the surgeon, also the blue tails and the pads, and the suture and the dressings. After the day's scheduled surgery was finished and all the instruments were cleaned and in the autoclave for sterilization, we sat around the stainless steel table and checked the clean muslin wrappers, because everything then, nothing was thrown away, nothing was made out of paper or plastic. And the wrappers were double thicknesses of muslin. And they were sewn by little women that came and donated their time as an auxiliary at the hospital. But anyhow, when they were clean and sent back up to surgery, we had to spread them out, and we looked for hairs, holes, and feathers. If there was a hole, you marked it and you set it back to the laundry. Of course, the feathers and the hairs you picked off. Okay. And then the next thing we had to do was gloves. And you know how many plastic gloves you all go through, or latex gloves. Ours were rubber, and they were recycled. They were washed after each case and hung on a rack of pegs to dry. Then we twisted them to trap the air in them and held the glove and circled our face, and if we felt any air, that was a hole, and we patched it with rubber cement and back on the peg to dry. And when it was dry, the gloves were powdered inside and out and placed in a wrapper to be autoclaved. I can't remember what we powdered them with. Was it cornstarch?
Cornstarch.
We powdered them with cornstarch. Okay. We were also on call in surgery and obstetrics, and we would sleep in our muslin scrub dress, and there's one over there, and you can see how tall or how hard, she is really stiff with starch, and no wonder we were scratching. But we would sleep in that, and we wore turbans then. But the next stage of hats was the snood that's over there on the stand that we wore in surgery. You couldn't have any hair showing whatsoever. Okay. If there was an emergency surgery or a baby about to be born, we were called to roll out of the bed and get over to the hospital. The obstetrics rotation consisted of being with women who were in labor and then in the delivery room, and then, of course, then the nursery. We insisted the physicians handing him instruments, sutures as needed, and holding the enamel basin to catch the placenta in. In pediatrics, we did hands-on care. Communicable disease, fractures, burns, malnutrition, rheumatic fever, and polio before the Salk vaccine were some of the illnesses that required hospitalization. And, you know, the kids stayed for weeks, not 2 days. Occasionally, a child with head lice was admitted, not for the lice, but with another diagnosis. An observant nurse would discover the lice. Every nurse and student nurse who had contact with the child had to do a lice treatment on their heads with Q-Prex. After duty hours, we would apply the Q-Prex to each other's heads, wrap a towel around them for an hour, and then we had to comb them with a louse comb, and then we shampooed to get the odor of the Q-Prex out of our hair, and it was really strong. And one night, 11 of the girls went down to my home to do this treatment. And when my daddy came in from 11 o'clock from work, He couldn't imagine what the odor was in the house and how many girls he had. Equipment was not disposable. Catheters and enema tubes were made of rubber and used multiple times. After each use, they were cleaned and sterilized. Patients with a catheter, of course, was in a metal bed that had a hand crank. They weren't electric, and you had to twist the crank to adjust their head or their foot. Well, they had a rubber tubing from the catheter, went down the bed, over the end of the bed into a 1-gallon glass vinegar jug. That vinegar jug sat in a white enamel basin on a footstool under the bed. And every day at 7 in the morning and 7 in the evening, the jugs were emptied, urine was measured, jugs cleaned, and back under the bed. It's a little different than what you run a catheter into. Enema cans, huh? You
On
want-
the,
Get up there.
using the catheters, and you get them all fixed, and the bed is all nice and neat, but when the patient rolled over or turned over, that would pull the catheter would come out of the jug, it would go all over the floor. We had to scrub that and really catch it from the head nurse.
Yeah. Okay. Enema cans were enamel, and a rubber tube came out of an opening on the side at the bottom. The can hung on a standard, or it was held by the student. A 3H enema was the order written on the chart by the doctor. 3H meant high, hot, and a hell of a lot. And this will really get you. We saved all the soap scraps if the patients didn't take their bar of soap home, and we kept them in a glass jar of water in the utility room, and that's what we made the enema solution with. Student nurse life training for the diploma in nursing was 3 full years. We lived in the nurse's residence next to the hospital. We had to be in bed by 10. On Saturday night, we could be out until 11, but the house mother sat at the desk in the lobby and checked us in, and you better not be late. Also, on Saturday night, you could sign out for an overnight if you were not scheduled to work on Sunday. Some of the girls lived too far to go home for one night, and very few of us had a car. My home was less than a mile away, so my parents had several daughters for overnights because they just didn't want to stay in the nursing home on the night off. The first year, you either got the week of Christmas or New Year's off, and 2 weeks summer vacation. The second year, you had the same holiday schedule and 3 weeks summer vacation. The third year, our senior year, the schedule was the same, but you could work on your day off and get paid $1 an hour. The third year senior schedule was the same. Oh, I just said that, didn't I? Okay. All right. So this was kind of the daily schedule for the student. Breakfast at 6 a.m., on duty at 6:45 a.m. Some wards had as many as 4 or 6 patients. Each student may be assigned to as many as 6 or more patients for nursing care from 7 a.m. to 9 a.m. Class was back over in the nursing home from 9 a.m. to noon. Then we had a quick lunch. At 1 o'clock to 4 p.m., we were back in class. We had a dinner for a half hour at 4 o'clock, and then we were on the floor from 4:30 to 7 p.m. to give patient care. Our study hours were 7 to 9 p.m., and we had to be in bed at 10. And you talk about a boot camp. If we had to study for a test, we would hang a blanket over our window in our room, put a folded bath towel at the bottom of the door to the hallway so the house mother could not see our lights were still on when she made her rounds inside and outside after 10 p.m. And outside she went with her flashlight. Charting patient records were done by hand using a straight pen with a detachable pen point. A glass inkwell pen holder held the ink. Blue ink was used from 7 a.m. to 7 p.m. Red ink was used 7 p.m. to 7 a.m. The loose medical forms were held between metal front and back chart holders. And if you'll look, I think on that table I have one of the inkwells, and Gail brought some of the pens like we used, and a bottle of ink, but at that time the ink was poured out loose, so we made messes with it sometimes. Medicines were given by a designated student nurse, and she carried the key to the narcotic cupboard. And on 2 East, wasn't it 56 or 57 patients on 2 East, and she was responsible to make sure all those patients got their medicines on time. Okay, all right. There was a medicine cupboard on each floor, and the medicine cups were glass, and I have one of those over there, and they were marked with teaspoon, tablespoon, ounces, and milliliters on the glass. And each patient's medicine was put in a glass, and our tray had holes for the glass, but it also had a little slit, and in that little slit was a little card that we had to write by hand, and there was a different color card for each time the medicines were to be given. And we wrote the patient's room number, their name, the medication, the dosage, and the hours it was to be given. After we got all that done, we rubbed both sides of it with household wax to make sure it was waterproof. And then it would fit down in that little slot by that cup. And then the student nurse would go with her tray to all the rooms, but she always had to check her card and check the patient, and then give them the glass cup to take their medicine.
Jenny, can I say something?
Sure.
I talked to my daughter-in-law yesterday who's working at Meritus Hospital. Today they have a cart that they go around with. They put in the patient's name and the drug, and the drawer comes out. She can pick it out. Then she knows she has it. When she shuts the door, the computer tells her she has the right medicine for the right patient. The computer also orders the medication up from the pharmacy, so that the nurse it's just automatic now. It's not as much a problem of wrong dosage, wrong medication, or anything like that, like we had.
Yeah.
And they don't have to count the narcotics like we had to count.
Well, when my son was in University of Maryland 6 years ago, the robot brought the medicine. She got off the elevator and she walked down the hall. She stayed close to the wall. She went over to the cabinet, she unlocked it, she put the medicine, locked it, went back down the hall and got on the elevator. That just about blew my mind.
We had the very same experience. It's scary when you first see it.
Yeah, I remember one time I was to give a pre-op.
You need closer because you
I don't talk about. Okay, sorry. I had to give a pre-op medication for a patient going to surgery. So you always have to ask the name, and you're supposed to check their name badge. Well, I came into the room and I said, "Mr. So-and-so," and he said, "Yes." So I must have forgot to check the name badge. So I gave him the shot, and I find out when I get back to the desk that I gave it to the wrong man. And it was for Dr. Fuller B. Whitworth, which was, you didn't want to do anything wrong with him, which brings me something else. But anyway, when he came to the floor, I really I told the head nurse what I did, and of course she had to tell the doctor. And he said, "Oh, well, he needed a good rest anyway. Just give the other guy a shot." So, and that coming from him was something, Because I remember one time when I was was on call for surgery, and nobody wanted to do surgery for him because he had red hair, and that, tells you he had a temper. So I was called out at 4:30 in the morning one time to do a C-section with They said, Dr. Whitworth, and I thought, oh, not him, please. But anyway, I went to surgery, and the circulating nurse, I guess, okay, the circulating nurse lays out all the things you need, the suture and all the instruments. Well, everything was going great until he asked me for the suture. And back then, you had to suture in little glass tubes. You had to break it, stretch out the tubing, and stick it in the needle holder. And they said, be sure and slap that needle holder in his hand when he calls for it. So I did. I slapped it in his hand. He went to take the first stitch, and up went the needle holder and across the floor. And I think he called me every name that he could think of. And I thought I was shaking like a leaf. I thought, how am I going to get finished with this surgery? But I did. And, of course, all the students that were on duty were watching this, And after we got through the surgery, I had to gather up all the instrument and take it to the scrub room. And I was doing fine. And the students all came in and said, oh, Jean, how could you be so calm with him yelling at you like that? And I said, I think I was anything but calm because I just felt myself shaking. But they said I looked so calm. And then the orderly that used to be so good to us and so ornery, he came into the scrub room and he said, oh, Jeannie, don't let that SOB scare you. Well, I started crying then, and I couldn't stop crying. But I was so glad that was over. But he didn't, he never knew who he was cussing up one side and down the other, and I never told him. But after that, I was working OB one time, and I was giving an enema to a patient. Well, I went to straighten up, and I got this shooting pain all the way up and down my body, and I passed out on her bed. And I was coming to, and I heard someone say, go get Whitworth, he's in the doctor's room. And I wanted to say, oh, please don't get him, please don't get him. But I couldn't say that, so he was very good then. He put me in traction for a couple weeks, and he was I wouldn't have had anybody else. And he delivered all 4 of my children, and I think I called him for everything I had to. So, but that was one experience I was glad was over.
Do you want to tell them what you did to Ann?
Oh. Oh, this is, yes.
We would be in jail now.
Today, yeah.
You're going to come up on that one?
Okay, well, her daughter,
Her mother.
her mother, sorry about that.
Jeannie was a bridesmaid at my mother's wedding. Set the stage. These guys are really good.
Okay, anyway, the day before her wedding, Pat says, oh, I think I'm getting a cold. Well, I apparently had the medicine key, so I said, well, I'll give you a shot of penicillin.
It was new then.
It was new. I said, have you ever had it before? She said, yes. And so I thought, well, she's not allergic to it. I gave her 1,000,000 units of penicillin. Well, after her wedding, I was in her wedding, and the day after her wedding, somebody came up on the floor and said to me, you won't guess who's in the emergency room, and she's swollen up like a balloon. And I thought, oh, dear heavens, what did I do? Anyway, I went flying down to the emergency room, and who's there but Fuller B. Whitworth? And I came in the room, and I stopped, and he says, it appears to me that somebody gave her a shot of penicillin. I wonder who that could have been. And I didn't say anything, but anyway, I was so worried because she looked terrible. And her husband, you can tell her what her husband did.
Well, you can tell me that part, but let me tell you the part that they get to Niagara Falls for their honeymoon, and she just blows up. She gets hives all over. She ended up being allergic to 5 or 6 different antibiotics. She was a mess. She had to wear a medic alert bracelet her whole life. And this one started that.
I'm glad we were good friends.
Exactly. And so Daddy was at first he thought she was allergic to him. And then you guys are too young to know, but they used to put buttons on mattresses.
Yeah.
And he cut all the buttons off the mattress because he thought the buttons were bothering her. And so when that didn't fix it, they got a one-day honeymoon. He brings her back from Niagara Falls, and all of her friends took toilet paper and put it down the emergency room hallways at Memorial with "Here Comes the Bride" on it. So you tell them what Daddy said.
Okay, well, her husband said to me, "I hope this happens to you when you get married." Well, I got married.
And it did.
And it did. I got kidney stones on my first day of my honeymoon. So we were in Virginia, I guess. And I didn't know, I was in so much pain, and I went to the office, my husband did, and the woman took us to a clinic there. Well, the doctor there had gas mask on every time I was getting a pain, and he said she needs to go to the hospital. So I thought, well, I don't want to go to the hospital down here. So I said, can I go back to Pennsylvania? And he said, well, you're going to need a shot. He gave me a shot of morphine before I left, and he said about halfway home you're going to need another shot. So he asked my new husband, he said, do you think you can give her a shot? He said, well, I guess if I have to. So we got halfway home, and I was getting in so much pain, and I had to go to the bathroom. So the only place was right there was a truck stop with, all these windows in front. And I was still in my gown and robe. I said, I can't go in there. And he said, well, you have to, and I have to give you a shot. So, he walks me in, and I go into the restroom, and all these truckers are looking at me, and I think, oh, dear Lord, I wonder what they're thinking. But anyway, we got back in the car, and he did go up the road a little while before he had to give me a shot, but he did it. And we got home, and I spent the rest of my honeymoon in the hospital. So,
What goes around comes around.
yeah, Gail's dad was very tickled about that.
No good deed goes unpunished.
Yes.
She thought she was helping Mama, and it didn't work out that way. I think my mother lived and became the first head nurse in shock trauma region 1 here in Cumberland at Memorial Hospital. So, and she worked with Sandy's husband, with Dave.
Okay, I think my stories are done.
Okay. Hypos, morphine, and etc. were prepared in a spoon, a little sterile water held over a Bunsen burner to dissolve. The syringes were glass and the needles were metal. They were cleaned and sterilized after each use. A small wire was run through the needle to remove any debris. And if the needle had a barb on it, we scratched it across a piece of sandpaper to take the barb off, and it was reused. Urine specimen bottles were glass, and a cardboard POG-type disc had the name and the patient's room name on it. The students were required to observe a number of autopsies. The morgue room was depressing, and it was down in the basement of the hospital. And it had, excuse me, shelves lined all the way around the walls, and there was a drop cord of light over the marble slab where the corpse was. Excuse me. The shelves had large jars of specimens from previous autopsies preserved in formaldehyde. The odor during the autopsy was more than one could imagine. One of our classmates fainted during her first one. At the time, Avon hand cream was really fragrant, and we would put a generous amount on our hands and hold our hands over our nose all the time we're watching this autopsy because the smell was awful. Avon did a good business. To be campus was our punishment if we did an infraction of the rules. And that meant you could not leave the nursing home or the hospital on your day off for X amount of days. I just have to have a drink. Excuse me. Anyhow, we couldn't leave the nurses' residence on our days off. And there was one instructor that just loved to catch us doing something wrong. I think
I can tell about one of the times that the year before us, students went over to across the street and would go sled riding over in the park. And anyway, one hit a tree and was killed. So from that time on, we weren't allowed to do that. But we found that the slope beside the nurse's home was really good. You take a bedpan and you sit on it, lift your feet, and you can go sailing in the stainless steel bedpans. The galvanized just stuck. It wouldn't go. But anyway, we would sneak those out of the basement where we had them stored and take them out. And that was a lot of fun. We really enjoyed it.
Why don't we take just a quick pause, and so you can know the students who are here. If you're a first semester student, why don't you raise your hand up really high? Okay, okay.
Wow.
Second semester, all together. Third semester, and fourth semester. Okay, first, second, and third. And we have several faculty and staff here as well. So why don't you raise your hand up as well? Nursing faculty, other faculty and staff as well. So just so you get to see who's here, mostly first, second, and third semester students.
That's impressive.
Yeah. Can we take a pause and maybe if they have any questions for you, and then you can get your thoughts and then finish up other stories? Is that okay? Any questions from the audience you'd like to ask these 4 nurses from the class of '54 from their experiences? Anything's on the table.
So did you find that you all had in the beginning of your career, did you have this reputation of eating your young?
I
Yeah.
didn't.
Early on in your career, did you have the reputation of eating your young?
Like being really rough on the nurses?
So being really rough on the new nurses, was that something that would have happened back in 1954?
Not really.
Tried to.
I found it when in nursing, the patients were really thoughtful of us. I mean, they tried to help us. In fact, I can give an example of one that I thought was wonderful. I felt like they saved me and kept me in training because of it. But it was, I was on 2 East, and I had worked morning, then I had the classes, and then I was to go back over from to 7 to 11 and work. Well, and I had this one room where it was 4 men, and they were fairly young, but the 4 in that bedroom, and you could look out their window, and you could see the nurses going back and forth to the nurses' home. So anyway, I came in at about 11 o'clock, and I said, now I'm off, and I'm going to have you tomorrow. I saw it on the sheet. I'm going to have you tomorrow. Please be good. And I was just, because I was always joking with them. Well, the next morning, I had never slept in, but I did that day. And I woke up, and it was 7:30, and I had to get in a uniform and get over there and hope that the head nurse wouldn't catch me, because I was always in trouble with her. And so anyway, I came up the back steps, and I went ripping into their room to get the basins. We had to get the basin, take it to the utility room, fill it with warm water, and get the towel and that they had, set their stand up so they can bathe their hands and face before breakfast. And I thought, I am really going to have a time with this. And when I went running in, the tables were all set, and they all had their water and basin, and I looked so startled, and they said, "Don't tell her, but we took care of you." And they knew that I was going to get in trouble, but they snuck, the one that was able to get up and around, he went in, and it's right by the nurse's station, and how he did it, I don't know. But he went in there 4 times getting a pail of water and setting everyone up. And so, I mean, the patients really helped us in many ways.
Speaking of her getting in trouble all the time, she and her roommate, in the wintertime when the radiators were hot, they decided to smear Limburger cheese on the radiators in the nurses' residence. Oh, what a smell. That was. And I don't know what punishment they got for that.
They never found out. No one. That's what I say. Everybody took care of each other because when they asked who did it, nobody would say.
confessed.
And I thought, well, if someone's going to get in trouble, I'll speak up. But if not, I'm going to be quiet too.
I mean, we worked hard, but we had a lot of fun.
Yeah.
And we're still, most of us, all friends today. We get together when we can. There are a lot of them, though, that can't travel anymore, so we try to go halfway to see them. But it was a great class, I think.
I think that's one of the advantages that we have, is we're living in the dorm, in the nurses' home. I came there not knowing a soul, but I ended up with numerous amends of good friends that have lasted over the years. I wanted to add to the nursing home, we had one television. That was in the lobby.
Yeah.
If you wanted to watch television, you went down there, and whoever got there first, they got the station. You watched whatever they decided to watch. We played cards down there. And otherwise, we just became good friends because we worked hard and we studied hard, and like they said, we helped each other. But I think the one good thing we did have was we had a dorm where we were all together for 3 years.
And when you're together that long, you tend to be friends. But
Another question from anybody, then we'll allow the conversation to continue. Another great question earlier. Any other questions? Yes.
I can't hear.
What kind of medications did you use for women who were laboring after in a pregnancy?
medications.
I remember Pitocin drips.
Yeah.
To get them
Oh,
going.
I had that for all 4 of mine. But I don't remember Newbane, do you?
Yeah, we did.
More than once, the doctors never got there in time to deliver the babies. And that's the truth. Because there was not the overhead bridge in Cumberland, and the railroad tracks, separated everybody. So the head nurse one day said to me, "I'll give her the gas if you'll catch the baby." And the baby's back there. My niece. And we caught the baby, and then when he came in, and I was also pregnant, and I was walking up the hall, and I had high heels on and a gown and carrying this little baby to the nursery. He said, "It looks like it's self-service around here."
Is there another question?
Okay, I just have a little bit more, and I'm sure it'll trigger some memories. And I do want to say something, and I hope Pat won't mind, but Pat's been through a lot of chemotherapy recently. And here she made the trip for this, and we're really proud of her. Okay. The hospital had porches on each floor at the end before they closed them in. And we would roll the patients out in their beds so they could enjoy the fresh air. And the patient stays were really long compared to what Medicare requires now. And the room rates were $9.50 and $11.50 a day. That's all it costs. But that was a lot of money in '54. After 3 very busy years, we graduated on June the 11th, 1954, in the auditorium of Fort Hill High School. We received our gold graduate nursing pins that had our year and our initials engraved on the back. Following graduation ceremony, the graduates had to move out of the nurses' residence and find other lodging, which had to be approved by the nursing director. The residence was then prepared for the next class of probies that would be coming in. Our final finishing date of the 3-year period was September 3rd, 1954. We were then employed as graduate nurses at a salary of $200 a month until we passed the state board. And then we got $220 a month. And that's just a wild sampling of Memorial Hospital School of Nursing, class of 54 memories of 3 wonderful years and the beginning of lasting friendships. None of you have asked about psychiatric, but our 3 years at Sykesville was really scary.
3 months, not 3 years.
Huh?
You said 3
Or
years.
3 months, yeah. It felt like 3 years sometimes. I mean, it was scary. And on one of the boards, this one, is that the one? One of them has pictures. No, it must be the other. One of them has some pictures of our patients at that time. And, of course, there was different levels, just like a prison. And the medium security was where I worked. And they had a wonderful craft department that you could do crafts with them. But then there was also patients that would not leave their clothes on. And they were in quilted denim suits that had rivets up the back that had locks that had to be opened with a key to get them on and off. And that's what they wore, so they couldn't rip their clothes off. Every door had 2 locks, which you had to open simultaneously to get through. But you also had to be very careful there wasn't one of them waiting to get out that door. And our class was the first one that worked from 1 to 9 in the evening. And there was 2 boys, and I don't know what you call them now, but they wore duck haircuts, and that was the style. But they had been in some kind of trouble, and they were brought to the mental hospital. Well, we had a big ring of keys that we put on our arm for each door. And so they decided they were going to escape, so they twisted one of our girls' arms, took her keys, and left the building. Well, it was snowing outside. They didn't have a coat, and at 1 o'clock, nobody would pick them up hitchhiking because everybody around Sykesville isn't going to pick up a hitchhiker. And they came back on their own. They decided it wasn't so bad inside after all. And another time, when they're sitting in the cafeteria, and after they finish eating, the student had to go around and collect the knife, the fork, and the spoon before they were allowed to get up from the table. Well, one of our girls, Eileen, went to collect, and the guy just jumped up and socked her in the jaw with the biggest fist and never said a word, and he said, "Back down." So, you know, we were really I don't know what you want to say, we weren't safe, that's for sure. And at that time, I didn't need to lose weight, and I lost 12 pounds. I was scared to death down there. And we came home every weekend, and my group was there from January, February, and March, so it snowed every weekend. And, of course, it wasn't the interstate. It was old Route 40 with a little white post in the cables, little light, and one of us would hang our head out the window to make sure we hadn't run into the post because you couldn't see, it was snowing so hard. Well, when I got home and my daddy let me in, he said, "What are you trying to do, commit suicide?" I said, "We're not staying down there on the weekend." But I did make nice friends, and sometimes the girls would be asked to take one of the patients home. There was one fellow we took to Oakland on our weekend, you know, but you wouldn't do things like that now. And, oh, another story, my sister-in-law is also a member of our class, but not able to be here today. And she was given, we gave alcohol back rubs 4 times a day. And she was giving this man a back rub. Well, he was putting his hands where he shouldn't have on her. And she said, "Stop it." And he didn't. So he tried it again, and she said, "Stop it." And he didn't. So she just took the bottle of alcohol and poured down his crack. He stopped. So, you know, like I said, we'd be in jail now. But we got away with things like that. Okay. You think of somebody else?
Well, I was just thinking, you never ask a mental patient how you're doing. Because I was working in the women's ward, and I had Alice. Well, we played cards every day, and they all cheated like crazy, but you know, you just went along. Yeah, they had their own rules. But anyway, this one morning I came in, and Alice was standing there, and I said, "Well, how are you this morning, Alice?" And she looked at me, and she says, "I'm crazy, you dumb SOB. Why do you think I'm here?" So I thought, I never asked how she was after that. But she seemed so normal, you know, except for the cheating. But that's...
It was amazing, the patients that we did have. And Sykesville did have like 4,000 and some patients at that time. But there was one had been the music director of Boulder County, and that man could play a piano like you would not believe. And he would play the piano for the group, and then all of a sudden he'd just get up and start dancing around, and then he'd sit down and start right in where he left off.
And when he played Lieberstrom all the time. It would go from that, he'd stop, and he'd go right back into it again.
It was quite a 3 months.
It was. I think I would have quit if I only had that last 3 months to do. I think I would have quit nursing.
Yeah, if we went in the beginning, we would have probably.
Yeah.
One of the exciting things I had been through was they have the big bathrooms with these huge tubs, and then they were raised, and what they could do is they could wheel the wheelchair in, put the patient at the back of the tub, tell them to put their feet in, and then we just slide them down into the tub. And so that worked pretty good, but we had this one lady, we slipped her down in the tub, we bathed her, and then we were trying to get her out, and she was big. And so one got on one arm and the other arm, and we slide her back and forth in the tub, and then we try to ride her up the end. And she'd slide back down, so we'd slide her back and forth and give her another shove, and she'd come back down. And we did this about 4 times. We were soaking wet. And she said, "What are you doing?" I said, "I'm trying to get you out of the tub." She said, "Oh, okay," and she stood up and stepped out. So it shows you how gullible you can be.
Okay, I basically don't have any stories to tell you. What I've done the last couple of days is talk to my daughter who works in surgery, my granddaughter who's a CNA in a nursing home, my daughter-in-law who's a nurse at Emeritus, to get some things that are changed from what I know when I went through training to what they're going on today. So that's basically what I did. One of the things they talked about was the fact that, like we wore uniforms, you all wear scrubs. So when you're a patient in the hospital, you don't know if they're a nurse, a CNA, an OT, PT, X-ray. You don't know where they came from.
Right.
And so that's one thing that's different today. I call us bedside nurses because what we did when we were in training with baths, back rubs, clean linens, change their beds. 3 times a day they got their hands washed. 3 times a day they got their back rub. 4 times a day they got their back rub. 4 times a day they got their bed straightened. Today, you basically don't do patient care. You're more what I call executive nurses. And it's like my daughter-in-law said, you're doing your charting on computers. We did ours by hand. And today, you are so much more in danger of lawsuits than what we were. I have an ex-daughter-in-law that what her profession is, she reads charts for lawyers that have cases that are being sued by patients. And her job is to read the chart to make sure that they charted properly, they charted what was right or what was wrong. There again, we didn't have to worry about that and when we were nurses, and that's one of the things today. Back to the scrubs, my granddaughter works in a nursing home, and she's a Disney fanatic. They go to Disney 6 times a year. They live in live in Tampa. And so all her scrubs are Disney. So if the patients don't know her name, they'll say, "We want Disney." And so then they know who she is. She said about standing up when the doctors walked in. I had a mortal fear of the doctors, and you had respect for them, but you were scared to death of them. And plus also our clinical supervisors. We had one in particular that if you were at one end of the hall and she yelled your name, man, you headed down the hall because you knew you were in trouble. And today, your doctors depend on you because our hospital, Meredith, has hospitalists. I don't know if they do up here or not. Yeah. And that's doctors don't know you. So they're depending on the nurse to know you. So you have a lot of responsibility as far as answering to the doctors. Our doctors gave us an order, we obeyed it. We didn't question it. We never asked a question. Today, they ask you questions and they expect you to call them and tell them if there may be a wrong medication or wrong dosage or something like that. The other thing, I think patients were sicker when we were nurses. Our gallbladder surgery patients would be in the hospital 10 days.
Longer than ever, some of them.
And they were sick. I mean, they were sick people. Today, if you're young and you're reasonable health, you'll have your gallbladder and walk out. Or you'll be in 1 day. Knee replacements, when I had mine done, you were in 4 days. Today, if I'd have it done, I'd probably go home this afternoon, or maybe definitely tomorrow. There's such a train. A lot of it, of course, is anesthetic. A lot of it, of course, is improvement in surgeries. A lot of it's improvement in medications. But I think that has all changed. The other
Cataract surgery. You have a cataract and you had to lay flat on the bed
With those sandbags.
with sandbags holding your head straight ahead.
10 days.
Yeah, 10 days.
I had
And
mine
now,
without.
think of how cataracts are done and how they're usually in doctors' offices or their own little infirmary that they have. I don't know if they do cataract surgery in the OR or not.
I had mine done in the office.
Yeah.
I had mine done at the hospital. And they send you home right after you wake
Right
up.
afterwards.
Well, I couldn't wake up. They couldn't get me to wake. And my sister-in-law was out and waiting for me to take me home. And they kept coming in and saying, well, she can go home when she wakes up. He said, but we keep waking her up, and she'll say, okay. And then we turn around, and she's asleep again. So I was there for hours. And,
Okay.
But, I can't take anything. It puts me to sleep very easily.
The other thing that is talked about was the fact that you all have computers. If you have a question, you go to your computer. We had to go back to the nursing home and get our books out and look. So my daughter that's in Florida said they have 5 robots that do their surgeries, their hip surgeries and their intestinal surgeries. And I said to my husband, I said, I wonder if the robots throw instruments at you like some of the doctors threw them. Go back to Dr. Whitworth. I do have a story to tell. I was on call, and we went over, and the mother was pregnant, and the baby had died. And he had to deliver the baby. And what they did was go behind the skull and pull it out. And he did. He kept looking at me and saying, are you okay? Are you okay? And I thought when I walked out that day, that man does have a good side to him.
He does, really.
So,
Or he
and let's
did.
see. Yes. One of the other things that's been developed is, since we were there, was HIPAA. Now, like I say, I'm more they were the fun stuff. I'm telling you the other stuff. And today, you can't even call the hospital and ask a patient's room. And yet, when we were working, we could tell everything.
Yeah.
We had IV in bottles. You have them in bags. Throw it away. The other thing is, my daughter is a physical therapist. When she came to Meredith, she worked with the doctor that did the knee surgery and developed the physical therapy program. But it got to the point that financially it wasn't practical to do the program. It's because now they do the knee, put you out 1 day or 2 days. So a lot of hospital care now is governed by the almighty dollar.
Yeah.
Which is, so. The one daughter said, I'm to tell you all, be good to your CNAs because they make your shift either good or bad. Treat your patients like you would treat your mother or your dad. Remember, they are afraid, they're worried, they're in pain, and they're in a strange place. She said, don't bring your stresses to work with you. Let them outside, because your patients have enough to worry about without you bringing your worries in. I saw a story one time where when a man went home from work, he walked past his tree and he went like this. And then the next morning he went out, he went like this. And his neighbor asked him why, and he said, I hang my troubles on the tree at night because my family doesn't deserve them. I pick them up in the morning when I go back to work. So let your troubles on the tree outside and take care of your patients. The other thing I found out, which I was interesting, then I'll stop, is a lot of the hospitals are not hiring 2-year nurses now. You have to either have your degree or sign. Meredith in Hagerstown makes you sign that you will get your BS in 2 years, or they'll fire you. And I just think that's strange. So, okay, I'm done.
We're running to the end soon, but you all do computers. And I have my notebooks over there, and that's my computer. That's all my notes from training. And the one black one is Sykesville, all the psychiatric stuff. And I started reading some of that the other night, and I was amazed that I'd even written some of it. But anyhow, I hope you all will take time to look at our displays, look at our pictures. We have the inkwell and things that you don't use, I'm sure. And our uniforms, this is a student uniform. And the graduate, she's up on the piano. We couldn't find a body for her. But anyhow, we did bring our uniforms and our capes. And this dress here is a scrub dress, which you wore in surgery. And I don't know, we've got a lot of things often, and some of the girls brought their memories. So hopefully you will take time to look at them and appreciate where you are today.
Kind of started off, if you could give one piece of advice for these future nurses, what would be your one piece of advice that you would give to them?
My piece of advice is I think it's probably the best profession a girl can get into.
Or a guy.
Well, yeah, but I'm 54, you know. But anyhow, I had the misfortune of losing my husband when my children were 5, 4, and 14 months. It was a great job to have, and when I got in public health, I could have the weekend off, and I could be with my kids, and it trained me for all the things that life was going to throw at me, and it will you too, things that you cannot even imagine might happen to you in future years, but something that you learned in nurses training will trigger. And that's my advice. If you can be a nurse, be one.
Other pieces, if you gave one piece of advice, what would it be?
Me, I don't know. really don't know. Just listen to your patients and find time to talk to them if they want to talk to you. Back when we were in training, we had to be in class at a certain time, but if a patient wanted to talk to you, you stood there and you listened to them. And I think just always take the patient into consideration. Did you want
Be
me
the
to-
kind of nurse that your patient will say, boy, she was a good nurse, or he was a good nurse. Be that kind of a nurse. Think about your patient.
And some of our patients even took us out to dinner after they went home. But, yeah, actually, I found a letter the other day, and the little boy is on one of these posters. Anyhow, he fell in a bucket of hot scrub water backwards. And he was burned from his waist all the way back down his legs. And he was in the hospital for months. And anyhow, I guess I got attached to him, and so did my husband. And every time my husband came in on the weekend, he brought him a toy. Well, I found this letter, and I had forgotten, but somebody had written it as it was him writing, but updated me on his life and what he was doing, and signed it, your little boy, Raji. And I thought, I forgot about that, but I'm glad I still had it, because I don't throw anything away, but, you do make lasting friendships.
I remember a young boy in Sykesville that they have dances for them. And, we danced with him. I never thought anything about it, but after I graduated, I got this letter from him, and it's laying over there. He was so appreciative of what I did, just dancing with him, and I thought nothing of it, because you just danced with all the, But he was just a young boy, and I kept the letter.
I found that it was easy to get close to the patients, and working in surgery, it seems like each thing I did, it was a learning experience after coming from here. And I worked every phase of the surgery. I loved every bit of it. I wasn't afraid to go in, no matter what they threw me in. I felt comfortable. And I think that's what you got to do is go ahead, put yourself out there. You'll learn. You may make some mistakes, but you still learn from them. And I think you and the patient benefit. But it's a wide world that surgery, or not surgery, but nursing, fits right into. And I advise you to take all the advantages you can get.
Is there a final question anybody would like to ask? Final question? I know the hour and a half has flown by. Thank you all for being here. Let's give all 4 of these ladies one more round of applause.
I have to read.
Before she starts,
Where did it come from?
I don't know if you know, but this group is the one that started the Rhoda Barton Scholarship. Rhoda was a classmate of ours, worked 47 years at Memorial. But anyhow, this poem was read at Rhoda's funeral, and it's kind of nice. She was there, so Jean's going to read it for you.
Okay, she was there. When a calming, quiet presence was all that was needed, she was there. In the excitement and miracle of birth, or in the mystery of loss of life, she was there. When a silent glance could uplift a patient's family member or friend, she was there. At those times when the unexplainable needed to be explained, she was there. When the situation demanded a swift foot and a sharp mind, she was there. When a gentle touch, a firm push, or an encouraging word was needed, she was there. In choosing the best one from a family's thank you box of chocolates, she was there humanity, its beauty, its good times and bad, without judgment. She was there. And now that it is time to be at the greater one's side, she was there. And I don't know who the author was of that.
I don't know either.
I would really encourage you, I know it is after 3:30. Please take a moment to come up to say hello to each of these four ladies, to thank them. Look at the displays. I know, you have other activities, I'm sure, but it's really worthwhile to reminisce, to share, to look at some of the pictures and really appreciate their wisdom. So again, thank you for being here today. Let's give them all one more round of applause.